Hey friends, we're on a road trip here and I've been catching up on the news and listening to all of the Omicron panic, and I couldn't help but laugh, and I wanted to make this video to kind of share with you some things that I'm seeing and I'm sure you're seeing as well. You know, back in 2020, when many of us said that using cases as a metric to gauge the severity of the pandemic was not a good approximation, we should actually be looking at hospitalizations. We should be looking at what percentage of infected individuals go on to develop severe disease or possibly die. Now, when we said that, of course, we were told that we didn't care, we were insensitive, we were not taking the pandemic seriously. But curiously enough, the New York Times just put out a report. It was late last week. A friend forwarded it to me today, and I saw earlier today Anthony Fauci echoing the same sentiments that were in this New York Times op-ed article, saying that, oh gee whiz, 22 years, almost 22 months into this crisis, the biggest crisis, healthcare crisis of our lifetime, maybe perhaps we shouldn't be using cases to approximate the severity of the pandemic, and we should actually be looking at, go figure, hospitalizations. Now look, we've been saying this, and I say we, individuals like myself, who have been promoting healthy living, diet, exercise, nutrition, modifying the predisposing risk factors, the underlying health conditions that tend to worsen disease severity. We've been promoting that, and we've been told that we're conspiracy theorists, that we don't care about grandma and all this. Now, what you're starting to see is all of these policies, these safety measures are starting to sort of conflict with one another, right? And you're seeing sort of the aftermath and the sort of the blowback of all this. And many major healthcare systems are now dropping the vaccine mandates that they imposed upon their healthcare employees and their workers. Because guess what? They're having trouble, they're having staffing shortages amid the biggest healthcare crisis of our lifetime. I mean, who would have thought that it was a good idea? I mean, what person would have thought it's a good idea to fire people for not following the rules, although they didn't perish or die during the initial outbreak, right? They're still here, they're still alive, they survived the worst of the worst when we didn't know anything about this pandemic or this virus, how it behaved. So we're starting to see sort of the fallout, the aftermath, the blowback, all of these conflicting policies. Another conflicting policy that I thought was quite interesting when I was hearing, I believe it was the mayor of Boston just yesterday, say that in order to fully participate in society in the city of Boston, you need to show your papers. And I think so they're following what New York City is doing. The mayor, Lori Lightfoot in Chicago, is doing the same thing, suggesting that if you don't get vaxxed, if you don't get your 5-year-old, she's 9 by the way, if you don't get your child vaccinated, even though we now know based upon the data and new recent CDC guidance on schools, suggesting that, oh yeah, well let's just sort of, we know that these kids are not a big vector of illness and disease, so maybe we just test the symptomatic ones and tell them to maybe go home, and we don't shut down the entire school, because obviously the unintended harms or the iatrogenesis linked with shutting down schools has a lot more collateral damage than just a kid getting a runny nose, right? So we're starting to see all of these policies and all of the things that people like you and I have been saying are irrational, are excessive. We've been talking about the unintended harms and the indirect effects and how those are actually greater risks for people than the actual direct effects of getting the disease for the vast majority of people. Like, all these things are starting to we're starting to see all these conflicts. And what I think is so fascinating, now I'm gonna get in trouble for saying this, but I'm just gonna say it because it's political, but there's truth to this. We've been told over the last 20 months that voter rights are such a big deal in this country because of white supremacy and all these underlying overtones of deep-rooted systemic racism, and that asking for ID to vote is just the worst thing that you could possibly do in a democratic society. Yet these major cities and these mayors that have been advocating for voter rights and abolishing voter ID are now mandating that you show your ID to prove that you've been immunized. Now, to the best of my knowledge, to get an immunization in the United States of America, you need to show identification. So how can two things be true? Sometimes in life, two things can be true at once, but in this particular situation, those two things cannot be true at the same time. Asking for voter ID cannot be racist if you are then mandating that if you want to participate in society and go to a gym, a restaurant, or a performance, a theatrical performance, that you show identification with your proof of vaccinations. Those are conflicting ideas. And so we're starting to see all of these conflicts in all of these supposed safety measures. And they're coming to roost. And reality is starting to kick in. And most Americans are starting to realize that this has become very political. Now, you might get mad at me for saying that about voter ID. So let me just give you another example of complete bias when it comes to what's going on with regards to the pandemic. And you may not even know about this information. The officials of the Office of Vaccine Safety Research, 2 of the top advisors, have resigned. They made the announcement in September 20th of this year. Marion Gruber and Philip Krause, I believe, are the names. Now, if this had happened, now let me pause. You know why they've resigned? Because the Biden administration and the White House has been circumventing the scientific sort of this apparatus of the government, the FDA, to undergo safety precautionary testing and evaluation to ensure that the boosters are being rolled out, stratified to the right people at risk or whatnot. They're in charge of the safety of the vaccine rollout. The Biden administration completely circumvented these scientists, and they have been doing this for a very long time, and they announced their resignation because they felt that politics was getting in the way of the safety oversight. Now, if this had happened under the orange man, that very terrible orange man, this would have been on the news. This would have led the news cycle for months. I mean, this would have been, oh my gosh, science denying Donald Trump has circumvented the safety measures that the FDA has set in place to ensure the safety of these vaccines. He's just trying to, but you haven't heard one iota. You have not seen these people in the news or anything. And I've been not wanting to make this a big deal because it gets deemed as political and that I'm, becoming partisan. As a libertarian, I don't care if you're Republican, conservative, liberal, independent. It doesn't matter to me. I want you to be healthy. I want your family to be healthy. And when politicians are circumventing the scientific body, that's not considered science. I mean, the FDA is designed to be an independent arbiter of safety with new medications. And what we're starting to see is this is all being the science. There's not really much science going on. If you look at what Gavin Newsom announced today, that all healthcare workers, mind you, many of these healthcare workers have worked throughout the roughest point of the pandemic. When we didn't know about this, when PPE, where there were shortages and not enough PPE for these physicians on the front lines, okay? Many of them have already had COVID. He's mandating for healthcare workers that they get a booster. Okay, so let's back up. What is the added benefit of doing that? Considering probably, I don't know the numbers of the infection rates in healthcare workers. It probably depends on the department that they work in, but if you're a hospitalist or if you work in the ICU, it's highly likely that in the last 20 months, you have been exposed to COVID. So with all due respect what I'm trying to say is, if you've been exposed to COVID and you've had 2 doses, you are exceedingly safe. I think the odds of you getting severely sick or hospitalized is probably next to 0, okay? Now you have a politician mandating, without any scientific evidence, that all healthcare workers get a booster without stratifying or any sort of account for the fact that some of these people may or may not have natural immunity and all this. I mean, how is this based on science? So please don't get mad at me saying, Mike, you're being political. I'm exposing the fact that political science is circumventing actual biologic science. And a lot of us are not sort of open to this. We haven't been aware of it. We've been, listening to what the media says and taking it for face value and haven't seen these conflicts. And that's why I wanted to make this video, to make you aware of the fact that this is not science at all. This is what I feel is going on is what's called and referred to commonly in business as a sunk cost bias, okay? So let's just pause this conversation about hospitals and COVID and all this. Okay, let's say your business is dying and you've worked your entire life to make this business go. And you keep investing, you keep pulling money from your house, and you keep doing anything to keep this business alive, or whatever thing you're working on. It's called a sunk cost bias, where we don't want to acknowledge that all of the effort that we've put into something, it's better to just walk away. It's better to just say, you know what, let's start over, let's reinvest, let's create a new business, let's do something, let's reevaluate. And you keep shelling out more energy, more time. And the announcement that Biden made yesterday about rolling out 500 million new test kits, COVID tests, you're like, by the time you manufacture and roll those out, this Omicron wave is going to be over. Like, that is completely pointless. What are we going to do? I mean, all of the experts, even Anthony Fauci himself, is saying a better metric as opposed to massive, cases and testing is how severe are the infections. If this is a common cold, that all the evidence and statistics up to now suggest that it is, why are we testing everyone for a common cold? What, have we ever tested for the common cold? Have you ever quarantined for the common cold? No. The answer is no, no, and no. So we have 89% of American adults are metabolically inflexible or metabolically unhealthy. Why aren't we rolling out 500 million glucose tolerance test kits or, continuous glucose monitors or things like that? Sleep monitors, ways to improve heart rate variability. Chronic disease claims far and away more lives than this virus ever has. And we've not rolled out any sort of mitigation strategies or tools that can evaluate and predict and prevent the prevalence or incidence of chronic disease. And again, as all available statistics up to now indicate, this is a very mild mutation due to some of the ability of the selective increase in the ACE2 receptor binding through these new mutations in the Omicron variant that lead to a more of a proximal upper respiratory tract infection that doesn't lead to the deep vein pneumonia and the viral pneumonia that can be very problematic for people. So this is what happens when you consume the news. So part of me didn't even want to make this video because I'm like, this stuff is so negative. But I know that you're probably being pulled in different directions from your family, from your coworkers, from your friends. There's this renewed panic about Omicron, despite the data that overwhelmingly indicates that it's a mild cold. But the world is in full-blown panic mode. I've seen people in Idaho here, which is way more tamed down than Washington, double masking outside. It's like, this is insane. So friends, where do we go from here? We have to think better. We have to enumerate the risks. We have to look at hospitalizations. We need to look at the unintended harm of our policies and our actions and start to actually think better. This is how we're gonna move forward. All right, friends, what do you think? Was this video helpful? Anyway, hopefully you have a great Christmas holiday. We have a great video coming tomorrow about apolipoprotein B that I know you'll enjoy. Thanks for watching all the way through. We'll catch you on a future video down the road. Bye now.